Welcome to the Band Nurse Files. We are going to be talking about today long COVID and how we still have not found the source of COVID. So a new article published a few days ago, it reveals that global health authorities have not identified a definitive patient zero for COVID-19 or the first human case linked to the outbreak. Experts now warn that despite exhausting tracing, the origin remains elusive and no confirmed individual, even as early cases drawn from Wuhan and elsewhere, continue to surface. What does this mean? That means that even now, we don't know who started it or whether the virus quietly spread before authorities knew to look. Like we've had reports in 2018 and 2019, different respiratory illnesses with negative testing. It's a medical mystery. And one more reason to question why early messaging minimized long-term consequences once the vaccines rolled out. So now we're going to really dig deep into what COVID is and what is long COVID. We underestimated COVID. Are we being told everything that we need to know about COVID when it comes to immune systems and our memory and cognitive health, and even if these vaccines were really effective? So we're going to dive deep into that today. So recent findings published in Nature Genetics have highlighted a link between long COVID and immune dysregulation. So particularly involves the T cells, which we're going to go over now. And they play the central role in the body's ability to fight infection and clear damaged cells. So what are T cells, or T lymphocytes, are a type of white blood cells, and they're essential to your adaptive immune system. Adaptive means that you're not born with this immune system. It means that you get it from your mom, or you get it from being sick, or you get it from vaccines. So there are two main types. They're the helper T cells and the killer T cells. So the helpers they train the other cells, like the helper, they help the other cells. And the killer cells, you see it in the name, they destroy the virus infected or cancerous cells. Cells do this really cool thing that I love the word and I love what they do. It's called apoptosis, which is that they're like kamikaze cells, basically, that they kill themselves when they know that they're sick. So I think that's the body is so incredible. It's like a mini city in your body. It's crazy. But in long COVID, studies show persistent T cell activation or exhaustion. So this means that your immune system becomes overworked and ineffective, failing to fully recover even months after the infection. So this chronic immune stress can lead to ongoing inflammation, autoimmune-like symptoms, and increased risk for other infections. That's what I've been saying, that we are not the same we were 5 years ago. So people are like, oh, because people aren't vaccinating. Yes, vaccine hesitancy does have to do with what's going on with the increased infections of respiratory illnesses. We have tuberculosis. We have all of these mosquito-borne illnesses, all of these fungal infections, bacterial infections. It's because our immune systems are not the same as they were 5 years ago. This isn't like the measles that it erases your immune system. It's called immune amnesia. This doesn't happen with this virus, but it does affect your immune system. And now studies are coming out due to the virus and due to the vaccine. So multiple studies, some of them from Nature and NIH database, confirm that COVID survivors, even with mild symptoms, are at significantly higher risk of cognitive impairment and psychiatric disorders. So a 2022 Lancet psychiatric study found that 33% of COVID survivors developed neurological or psychiatric conditions within 6 months. So the CDC and global health registries report up to 1 in 4 young adults experiencing depression, anxiety, and memory issues following infection. And a UK biobank study even revealed physical brain shrinkage in areas responsible for smell and memory after mild infections. And it doesn't end there. So the population level data shows that the world got mentally sicker during the pandemic, even if you were sick or not. So they're saying they're contributing this to lockdown, to stress, to seeing your family members pass, or being scared that you're going to die yourself. So a 2023 Nature Communication study showed that an average global brain age increased by 5.5%. That's a lot. meaning our collective cognitive declined faster than expected, even among those who never caught the virus. So what's really happening here? Could this be like the price of downplaying long-term neurological outcomes? So early in the pandemic, public messaging was simplified, prioritizing urgent use of vaccines and urgent infection control over long-term like risk disclosure. And once vaccines were deployed, the focus quickly shifted from hospitalization and death, leaving out the lingering brain fog, fatigue, and immune dysregulation that millions are still reporting and we don't have treatment for yet. So some scientists and clinicians did whisper concerns. Studies did come out, but they were suppressed until now. So they saw patients suffering, they wrote case studies, but the mainstream health narrative stayed locked in crisis mode and in pushing out vaccine mode. And now years later, research is quietly confirming what those early observers feared, that long COVID is not rare. And for many, the immune system remains altered. So this isn't like a one in 20 people. No, this is a lot of people are suffering from this, either mild or severe cases, but it's happening. So let's talk about biomarkers, because that's where that's where they're changing like the narrative of how we define long COVID. Okay. So immune biomarkers are measurable molecules in the body that reveal how the immune system is functioning. In long COVID, researchers have found elevated markers like interleukin 6 receptor, and this protein it signals inflammation in your body, and IFNB or interferon beta, and this indicates viral immune response, and ciliary neurotrophic factor, linked to nerve and immune repair, meaning that these biomarkers were elevated, meaning that their body is working overtime with inflammation, with antiviral response, because they're still fighting a virus that's probably not even there because the immune system is still haywire. So why does this matter? Because these markers may predict who is most likely to develop long COVID and even guide future targeted treatment. But as much of COVID science, these findings aren't making headlines at all. Why is that? Why? I don't know. So now before we dive into the controversy, let's talk about science, right? First, we talk about science because here in the Bad Nurse, we always like to talk about science and we like to be as factual as possible. Yes, we do ask questions. Yes, we are curious. Yes, we are skeptical, but we also have to maintain our feet on the ground and not have our head in the clouds, because we need to know exactly what's going on, because science and medicine do exist. Just because evil people and people that want to take advantage of the lesser are ruining science, it doesn't mean it doesn't exist. It doesn't mean that medicine can be good, because medicine has saved lives and vaccines have saved lives. But when it comes into the wrong hands, just like everything, greed takes over, and now we're here. So how mRNA vaccines work? I'm still iffy about mRNA vaccines myself. This is a really new technology. This was the first vaccine ever used with mRNA. So we were like guinea pigs for these people. So mRNA vaccines deliver genetic instructions, so the actual DNA or the RNA, that's what viruses have, RNA, that tell your cells to produce a harmless spike protein found on the surface of the coronavirus. So the vaccine is telling your body to make the protein that's on the coronavirus. This primes your immune system to recognize and destroy the virus if you're exposed. It's brilliant. And it's used experimentally since 1990s, but deployed globally for the first time during COVID under emergency use authorization. So this is the first time we use it. And what a time to use it, right? In an emergency. That everything is haywire, nothing is accurate, we don't know what's going on, but let's deploy an emergency, whatever. So real world data tells us something else, right? Vaccines are highly effective in reducing hospitalized death, but when it comes to preventing infection of long COVID, protection was limited. So if you took 2 doses of the COVID vaccine, you had 37% reduction of long COVID. If you did 3 doses, you have a 69% protection. It's not even 50% if you do 2. So, and emerging reports are now investigating post-vaccine neurological symptoms in rare cases like brain fog, fatigue, and autoimmune dysfunction, similar to mild long COVID. So it raises the question, Could certain individuals be genetically or immunologically predisposed to immune overactivation, either from infection or vaccination? This is still being studied, but it's still a conversation worth having, especially when millions are having symptoms without answers. So let's talk about long COVID and what kind of symptoms there are. So common symptoms are brain fog, memory loss, trouble concentrating, depression, anxiety, insomnia, chest pain, shortness of breath, muscle aches, POTS, which is postural orthostatic tachycardia syndrome. I'm noticing a lot of kids getting this. A lot of kids are getting POTS. This has been diagnosed repeatedly, a lot more than I used to see. So fatigue and post-exertional malaise. Malaise is that you just feel like shit. And gut issues, hormonal imbalance, and tinnitus. Tinnitus is ringing in your ear. Symptoms often fluctuate and they overlap. So it's really hard for doctors to know what's going on, because sometimes you won't have a symptom for months and then all of a sudden it hits you and now you have it for 5 months. So this is really, really hard. So people are feeling gaslit because providers don't know what it is. And they're like, oh, you have anxiety. It's always anxiety. Here, take anxiety medications. Here, take a beta blocker so you can relax. No one's really taking the time to consider what's going on. So there's still no FDA approved treatment for long COVID, but we are having approaches, maybe. So there's you have teams of doctors working, like neurologists, immunologists, rehab therapists, cognitive rehab, like memory training, attention therapy, fatigue management, like pacing strategies, rest cycles. There are experimental treatments like anti-inflammatory drugs, antihistamine, antivirals, and there are supportive tools like wearing monitors, heart rate training, compression socks. So biomarker testing may soon guide personalized treatments, helping us decode who benefits which intervention. It's so frustrating for these people. I think all of us have long COVID, so we're all affected. So if you suspect you have long COVID, don't dismiss it. Seek medical evaluation, track your symptoms, ask about biomarkers if they're available, advocate for referrals to neurologists, to immunologists, to whatever you need. And remember, what you're feeling is real, even though you feel invisible. It is happening to you. Don't get gaslit. Don't let them tell you it's anxiety. Whatever you're feeling is real. So this isn't fringe talk. It's peer-reviewed science finally catching up to what patients have known all along and what we've been saying all along. So as always, friends, I hope you stay safe, do your research, ask questions with me, and as always, follow to stay in the know.